Dr. Sharkawy, Canada has really been thrown a curveball this morning with this news from Moderna that we're only going to get about half of the doses we expected at the end of the month of April. Give us your thoughts on that. We do know Pfizer is going to send more doses, but does it throw a real monkey wrench into our vaccine rollout nationally?
Well, obviously, any change in the anticipated arrival of vaccines at this point is going to be very detrimental to our efforts to combat this third wave. But I think it illustrates the precarious situation that we're in, and that we should not be relying solely on vaccine supply to determine our way through this. It's become, I think, very clear that these hiccups are very frequent. They've happened repeatedly over the past few months. And without a domestic supply with manufacturing capability here in Canada, I would anticipate that this sort of thing is going to recur. So I think we need to invest our efforts here on making sure we're taking care of the other side of the equation. Our public health measures to date have not been good enough. It's clear that things are completely out of control. We're seeing a crisis of historic proportions now unfolding in the province of Ontario. We've got to pull together and take a very different approach if we're going to get through this. The vaccines are not going to do it, at least not over the next several weeks. And a lot of people are going to get very sick, and a lot of people are going to die as a consequence.
And I've been mentioning this morning on the show that some of your colleagues have tweeted about seeing patients coming into the ICU who are eligible for the AstraZeneca vaccine but haven't got it. Can you talk to us again about the importance of taking the shot that is available to you so that in 2 weeks' time, you yourself don't end up sick?
Yeah, I think we need to really put this in perspective. And unfortunately, a lot of bad marketing and a lot of bad communication has gotten in the way of a lot of good science. The reality is, if we break this down to, let's say, a woman between the ages of 20 and 50 right now, that's the group that we worry about most with respect to these vaccine-induced clots. Their risk of acquiring COVID-19 and of dying of COVID-19 is astronomically higher than it is of getting one of these clots. If we look at the data from the Johnson & Johnson vaccine, for example, it's somewhere in the neighborhood of 1 in 6.5 million. We think it's probably the same mechanism that's responsible for AstraZeneca. There are 22 women in that age group who are dying every day in the United States from COVID-19. So you do the math. Understand that if you're living in the GTA, for example, you're a 35-year-old woman, maybe an essential worker, your risk of dying from COVID-19 is way higher than any potential clot related to a vaccine. I don't think that message is clear enough for enough people. I don't think enough people understand that the more people get vaccinated, the less there is out there, and everyone gets a little bit more benefit. So we've got to do a better job with our messaging and channeling that to people in need. We can't be driven by too much fear, and as I say, bad marketing and bad communication.
And people, Dr. Sharkawy, are being choosy because they think that the Moderna vaccine or the Pfizer vaccine will offer better protection against the variants. What do you say to that?
There's certainly no evidence that that's the case. In fact, the dominant variant right now, which is B.1.1.7, is covered very well by the AstraZeneca vaccine, which has been used very widely, of course, in the UK. So that's a misconception we need to do away with. And we need to recognize that, once again, it's important to remember 100% protection against hospitalization, severe disease, and death from every approved vaccine. The differences between 62, 72, and 95 is related to mild disease, which is not likely going to cause serious problems. That's not the reason why we have lockdowns. That's not the reason why we have our healthcare system capacity stretched to historic limits. The reason is that not enough people are getting vaccines, period. And we've got to change that. We can't leave any vaccines wasted if people are eligible to receive them.
And what also may cause some vaccine hesitancy are these reports. There was one yesterday out of the U.S. that showed people that had both shots were still getting COVID-19. We know that if you get the flu shot, it's not 100% guaranteed that you're not going to get the flu. So again, can you put that into perspective for us, Dr. Sharkawy, around our expectations when it comes to these vaccines?
Sure. And I think you nailed it there. Nothing is 100% effective. But the reality is, these people who are getting reinfected with less severe presentations of this virus. And unfortunately, if you've got tons of circulating disease within your community and you're not doing enough from a public health guidance standpoint, you're not going to be able to put a lid on this pandemic just with vaccines. We keep forgetting that the vaccines are not the golden parachute alone. We have to do this in tandem with good public health measures. You can't open up quickly. You can't let things happen with respect to institutional policies around safety and labor standards and paid sick leave not being addressed and expect that vaccines alone are going to do the job. You have to address the other drivers and root causes.
Okay. Dr. Sharkawy, thank you so much for all of that. Really appreciate it, as always.